Attention Deficit Hyperactivity Disorder, ADHD, Comprehensive Overview. Attention Deficit Hyperactivity Disorder, ADHD. Attention Deficit Hyperactivity Disorder, ADHD is a neurodevelopmental condition characterized by persistent patterns of inattention, hyperactivity, and impulsivity. ADHD affects both children and adults, often causing significant challenges in academic, professional, and social settings. It is one of the most common mental health disorders diagnosed in children, but its effects often persist into adulthood. Understanding ADHD involves exploring its symptoms, epidemiology, causes, and the available treatment options. Epidemiology of ADHD, prevalence, and global statistics. Global prevalence. It is estimated that around 5% of the global population has ADHD, with higher rates of diagnosis in Western countries, particularly in the United States, Canada, and Europe. United States, according to the Centers for Disease Control and Prevention (CDC), approximately 9.4% of children aged to 17 are diagnosed with ADHD in the US, equating to over 6 million children. ADHD is diagnosed more frequently in boys than in girls, with a male-to-female ratio of approximately 3:1. Global differences. Rates of ADHD diagnosis can vary significantly across countries due to differences in diagnostic practices, cultural attitudes toward mental health, and healthcare accessibility. For example, ADHD is more commonly diagnosed in North America, while other regions, like parts of Asia, have lower reported rates, possibly due to cultural differences in understanding and interpreting behavior. Adults with ADHD. While ADHD is often associated with childhood, it is increasingly recognized that the disorder persists into adulthood. About 25% of adults are estimated to have ADHD, though many adults remain undiagnosed due to misdiagnosis or lack of awareness of adult ADHD symptoms. Epidemiology of ADHD. Age and gender factors and comorbidities. Age of onset. Symptoms of ADHD typically appear before the age of 12, and in some cases, as early as age 3. Early diagnosis is crucial for effective management. Gender. ADHD is diagnosed more frequently in boys during childhood, but the gender gap narrows in adulthood. While hyperactive and impulsive symptoms are more noticeable in boys, inattentive symptoms, which are more subtle, often go unrecognized in girls, leading to later diagnoses in females. ADHD is often associated with other psychiatric or neurological conditions, including anxiety disorders, depression, learning disabilities, oppositional defiant disorder (OD), substance use disorders, especially in adolescents and adults, bipolar disorder, conduct disorder. Symptoms of ADHD. The symptoms of ADHD are divided into 3 categories: inattention, hyperactivity, and impulsivity. These symptoms manifest differently in each individual and can vary in severity. ADHD symptoms may interfere with academic performance, work productivity, and relationships, often leading to frustration and low self-esteem. Inattention symptoms. Individuals with ADHD may exhibit the following behaviors related to inattention: frequent careless mistakes in schoolwork or other activities due to lack of attention to detail, difficulty sustaining attention in tasks or play activities, seeming not to listen when spoken to, even though there is no obvious distraction, failure to follow through on instructions, leading to unfinished tasks, difficulty organizing tasks and activities, such as keeping track of assignments or completing chores, avoidance of tasks requiring sustained mental effort, like reading or doing homework, frequently losing things, such as keys, school materials, or personal items, easily distracted by extraneous stimuli, often unable to focus for long periods, forgetfulness in daily activities, such as forgetting to turn in assignments or attend appointments. Hyperactivity symptoms. Hyperactivity refers to excessive motor activity, especially when it's inappropriate or excessive for the situation, fidgeting or squirming while inability to stay seated in situations where it's expected, e.g., at school or in meetings, running or climbing excessively in inappropriate situations in children, inability to play quietly or engage in calm activities, excessive talking or interrupting conversations, constant motion, and an overall sense of being on the go or driven by a motor. Impulsivity symptoms. Impulsivity refers to difficulties in self-control and the tendency to act without thinking, interrupting others during conversations or activities, difficulty waiting for one's turn in games or group activities, blurting out answers before questions have been completed, making hasty decisions without considering the consequences, which can lead to risk-taking behavior, intruding on other space or activities, often without realizing it. ADHD subtypes. There are three primary types of ADHD, based on the predominant symptoms. 1. ADHD, inattentive type, characterized by significant inattention without prominent hyperactivity or impulsivity. 2. ADHD, hyperactive impulsive type, dominated by hyperactive and impulsive behaviors, with less inattention. 3. ADHD, combined type, a mixture of both inattention and hyperactivity impulsivity symptoms, which is the most common type. Causes and risk factors of ADHD. ADHD is thought to arise from a combination of genetic, environmental, and neurological factors. Genetic factors. There is a strong genetic component to ADHD. Studies have shown that ADHD tends to run in families. If a parent has ADHD, their child is more likely to have the disorder. Genes related to dopamine regulation are often implicated in ADHD, as dopamine is a neurotransmitter involved in attention, motivation, and impulse control. Neurological factors. Brain imaging studies have shown differences in the brain structure and function of individuals with ADHD, particularly in areas related to executive functions planning, working memory, and impulse control. Neurotransmitter imbalances. The role of dopamine and norepinephrine in ADHD is well documented, with some research suggesting that abnormalities in the pathways that regulate these chemicals contribute to the symptoms. Environmental and prenatal factors. Prenatal exposure to alcohol, tobacco, or drugs can increase the risk of ADHD. Premature birth and low birth weight are also associated with an increased risk. Lead exposure and other environmental toxins can negatively affect neurodevelopment. Social and family factors. Although ADHD is largely genetic and neurological, environmental factors such as family stress, poverty, and early childhood trauma can exacerbate symptoms or interfere with the management of the disorder. Diagnosis of ADHD. The diagnosis of ADHD involves a thorough evaluation by a healthcare provider, typically a pediatrician, psychiatrist, or clinical psychologist. It includes 1. Clinical interviews. A detailed interview with the child and parents in the case of children to assess the child's history, behaviors, and symptom patterns. 2. Behavioral rating scales. Standardized questionnaires, such as the Conners rating scales or Vanderbilt ADHD rating scale, are used to assess symptoms and compare them to age-appropriate behavior norms. 3. Observations. Observing the child in different settings, e.g., home, school, helps confirm the presence of symptoms across various environments. 4. Exclusion of other conditions. Since ADHD shares symptoms with other conditions, such as anxiety, depression, and learning disabilities, other causes for the symptoms must be ruled out. Treatment for ADHD. ADHD treatment typically involves a combination of behavioral therapies, educational support, and medication. The goal of treatment is to manage symptoms and improve functioning in daily activities. Inattention symptoms. ADHD treatment typically involves a combination of behavioral therapies, educational support, and medication. The goal of treatment is to manage symptoms and improve functioning in daily activities. 1. Medications. Medication is often a key component of treatment, particularly for managing symptoms in moderate to severe cases. Stimulants. The most common and effective class of drugs used to treat ADHD. Stimulants increase dopamine and norepinephrine levels in the brain. Examples include methylphenidate Ritalin, Concerta O amphetamine salts, Adderall, Vyvanse non-stimulant medications. For individuals who do not respond well to stimulants or experience side effects, non-stimulant medications may be prescribed, including atomoxetine Strattera, a norepinephrine reuptake inhibitor, guanfacine Intuniv, and clonidine Cabfé, alpha-2 adrenergic agonists, typically used to treat hyperactivity and impulsivity. Behavioral therapy. Behavioral interventions focus on helping individuals develop coping strategies and new behaviors to manage their symptoms. Cognitive behavioral therapy, CBT, helps individuals change negative thought patterns and develop practical skills for managing attention, organization, and impulse control. Parent training. Parents may receive training in specific strategies to manage ADHD behaviors, such as setting clear expectations, rewarding positive behaviors, and providing structure at home. Behavioral interventions at school. These include classroom accommodations such as preferential seating, breaks, and extended time on tests, along with specialized teaching methods to help children with ADHD thrive in the classroom. Educational support. Children with ADHD often require additional academic support. This may include individualized education plans (IEPs) or 504.